This is Steven. Next month, he turns 21 and graduates from high school. At age 4, Steven was diagnosed with autism. At 7, he began receiving services through a special federally funded program. Now the state will provide the same kind of services thanks to the passage of House Bill 2693 by the state legislature earlier this year. The new law requires insurance coverage for children with autism spectrum disorders. West Virginia is the 25th state in the nation to pass such legislation. Among those celebrating passage of House Bill 2693 is Mike Grady, CEO of the Autism Services Center in Huntington. The organization provides a broad range of services to individuals with developmental disabilities in Cabell, Wayne, Mason, and Lincoln counties, from counseling and social skills to employment support.
With a prevalence rate of 1 in 110, 1 in 70 males, by the way, the more work we can put in with children having a positive impact, the less expense is going to be down the road for society. This is actually one of those bills that will save society money if you want to just look at it in economic terms. In terms of doing the right thing, we're setting up a child to have a greater chance of succeeding later on down the road.
As of July 1st, coverage will include applied behavioral analysis beginning at the age of 2, with an annual cap on benefits at $30,000 for the first 3 years. Afterward, a child with autism may receive coverage up to $2,000 a month until the age of 18. Barbara Becker-Cottrell is the director of the West Virginia Autism Training Center at Marshall University.
This insurance bill opens up that door for so many families across our state and so many children that will now have access to the early intensive programs that are definitely going to help them for the rest of their lives.
She says every day can be a roller coaster ride for these families and the center as they cope with the condition.
Families never know what their day is going to be like, and if we at the training center can provide them with supports, give them training, work with their children, and make a difference in not only their child's life, but in their lives, and to see them smile and to see them celebrate successes, that is what keeps me going.
Becker-Cottrell says the Autism Training Center operates on the principle that individuals with autism can lead happy, productive lives and deserve the same quality of life that others with disabilities enjoy. Marshall also houses the College Center, which helps students as they work toward a college degree. The center is renowned across the country. Mark Ellison, the associate director, says other colleges have benefited from the center's work.
The most significant thing that we've done is help other universities develop similar programs. We've been really heavily involved with the University of Alabama over the years, with some other regional universities, and helped a handful of them develop similar programs.
Just making sure, yes.
Justin is one of the students in the program and on schedule to graduate in May.
After I graduate from college, I'm going to be able to leave on May 8th, 2011 and go back to California. And so if I go back, I'll be working in California in a VA hospital to volunteer for pharmacy technician.
For West Virginia Public Broadcasting, I'm Clark Davis in Huntington.